Hi, Dr. Quinn.
Hey, good afternoon.
Well, with cases going down, do you anticipate there's going to be any interest in getting another booster shot?
Well, the deal is we are finally on the offense, meaning that we're making moves when our backs are not against the wall. Basically, what's going on is the FDA, the CDC, and all the other organizations that make these decisions, they're looking at the data. And overwhelmingly, we're taking a lot of lessons that we're applying as far as our decisions. And it's been overwhelmingly decided by the FDA. It's a good idea to go ahead and advise everyone 50 years and older. And they picked this number because the science has shown us if someone's over 50, they have a higher chance of having complications of coronavirus, and they have less of a maintenance of their immune system. So this is a group that's been picked to get that second booster and increase their immune system so we'll be even better protected.
Dr. Quinn, do you anticipate this second booster being approved for more age groups soon?
Well, as of right now, if someone is 12 years and older, they can go ahead and get the second booster of Pfizer, according to this new recommendation that was released today. And if they're 18 years and older, they can either get the Pfizer or they can get the Moderna if they have a weakened immune system. These are individuals that have chronic medical conditions, anything that would decrease their immune system. If they're 12 years or older, they can get the second Pfizer booster. If they're 18 years or older, they can get the second Moderna. So they're already looking at the younger population, but as far as just generalized, as far as everyone getting that second booster at this time, they're going to look at it a little bit more next month in the middle of April when they'll make further decisions.
Dr. Quinn, is there anyone who shouldn't get this booster shot when it's made available to their age group?
Right now, they're not really advising against it for anyone if it's advised for their age group, unless they've had an allergic reaction, which is very, very rare. I mean, the take home is, as I said, we've learned a lot of lessons during this pandemic. And with these lessons, all this data that we've collected, we're now making informed, educated decisions that are best to decrease the risk of people losing their lives. As I said at the beginning of this interview, we are now on the offense. We're able to look at things that are coming and put in measures so that we can protect our community as much as possible. And as a healthcare provider, I'm going to tell you, it feels really good to finally start getting a handle on this pandemic.
This question is something I think we've asked you before, but it's always good to ask again. Do you believe it will be recommended for everyone to get a vaccine every year now?
Most definitely. I mean, because the data is overwhelmingly showing. I just want to talk about this CDC data. As of January the 29th, showed the rate of COVID deaths among those that were not vaccinated was 0.8 per 100,000. For those that were fully vaccinated and boosted, 0.10. That means if you've not been vaccinated, you have an 8 times increase in the possibility of losing your life. These vaccines are very effective as far as decreasing your possibility of going into the hospital and or losing your life. And for the healthcare community, we feel very confident that we have a tool, a weapon that we can help protect our patients and just get through this pandemic and be prepared for the future, for future pandemics. So yes, vaccines will be something that is not going to go anywhere anytime soon because we want to help our community.
All right.
I guess we can roll up our sleeve again. Thank you, Dr. Quinn, for being with us today.
Hey, thank you for having me.